So before we begin, I've already assessed my patient. I've assessed the lung sounds and made sure that the patient is sitting up in a high Fowler's position. And I've also made sure to inform the patient on what the procedure will insist of, okay? So I have my equipment here. I'm going to start by opening up my tracheostomy kit away from me. Okay. I'm going to take this, and actually I could put gloves on, but for video, I will put gloves on, but for video purposes, I'm just going to speed through that part. Okay, so I have my gloves on. I'm taking this out, being careful to only touch the 1 inch outer margin. Okay. Being very careful, and this is my sterile field. Now I can take my kit and dump all of the contents onto the sterile field. Being careful not to touch the field or anything like that. And I'm going to use this tray to hold my saline. Now I have my gloves on still. I'm going to take my normal saline, check the expiration date, and I'm going to instill the saline into each container or compartment of this sterile tray. Okay, so we're opening, we're pouring saline in each compartment. Okay. Now I'm going to dilute the larger compartment, which is this compartment here, with my hydrogen peroxide, which I've checked the date. Okay. Okay, now, so we're going to start with suctioning. I'm going to take my gloves off, wash my hands again, and start with my sterile saline, or my sterile gloves. So we're being very careful not to touch anything. And here I have my suction, and it's already turned on. All right. All right, starting with this dominant hand, we're going to grasp the inner part of the glove, being very careful, putting it on, careful not to touch our hands or anything like that. Taking our two fingers, index and middle, scooping underneath, okay, and then we're sliding our hand in. All right, now I am sterile, okay, so I'm going to go over here, and I can touch anything in this sterile field now. Okay, so I'm going to rearrange my equipment to where everything is organized, not leaning over it or anything like that. I'm being very cautious. I'm going to grab my suction catheter. Everything else is organized. And I'm going to place it nicely into my non-dominant hand. Okay. And now this hand is going to be clean. So we're going to contaminate this hand, but this hand is going to remain sterile. Okay. So we're going over to our suction, and we're going to carefully place this on, being careful not to touch our sterile glove. We're going to place it onto the suction. Just being very cautious. All right. Now we can untangle that, being cautious not to touch anything, and this is now clean. Oh, can you push okay on there? The batteries are low. Is it still recording? Are you sure? I don't think so.
The button is red.
But the time isn't moving. Oh, okay. Sorry. So this is still sterile, okay? We're going to dip it into the saline only. When we dip it in, we're going to hold this to suction, okay? And we're going to go into the trach until we feel resistance, or about 6 inches, and then we're going to hold, okay, to suction, and we're twisting, and then out. Okay, so that is suctioning a kit. We can put this back, dispose of this in our biohazard bag. Being careful to keep an eye on our sterile field. Going to perform hand hygiene. For video purposes, I'm going to say that I will put my gloves on, my clean gloves, not sterile gloves, and I'm going to change the patient's tie. So leaving this one on, I'm going to bring him over so you can see. I'm going to put this through. Okay. Clamp, go around. All right. Put this one through. Being careful not to go too tight or pull the patient's tracheostomy. Okay, now I have this one. I can go ahead and untie the old one, or having another nurse hold it, and we will pull any gauze that will be under here from out, okay, and throw it in the trash. And remember, we have our gloves on, so now we can go ahead and take out the old, or the tube going from a 6 o'clock to 3 o'clock. Then we're going to put this into our mix. So just dump it in there. Okay, now we can take our gloves off, wash our hands, and now we are going to do our sterile technique to clean. That's sitting in there. I wash my hands, taking off my gloves. I'm going to move my guy just a little bit. Okay, so going in. Okay. All right, now we're doing the same technique. We're holding, going in, careful not to touch our fingers. Okay. Scoop method. In, careful not to touch. Okay. Sterile. Now we're coming over here to our sterile field. We have our tube cleaner. I'm going to take, grasp. Okay, so we're cleaning the inside, making sure we're cleaning the outside. We can see. Okay. Okay. Agitate it a little bit. This can go in the trash. This is still a sterile hand. Now we can put it in our normal saline and agitate it. Once that's been agitated, we can go ahead and take our tube cleaners, clean the inside, or dry the inside with this. Okay, and then we're taking this. Okay, we're drying that. Now we can go ahead and put this back in the patient. So I'm going to go in at the 3 o'clock to 6 o'clock. Make sure we lock it. It's locked in there now by twisting. And that's in now. So now we can go ahead and finish with the procedure. So we're just going to take some gauze here, dampen it, not in the actual mix, but in the saline that we have here in this third part. We're going to just dampen it a little bit, wring it out. Go ahead and clean underneath, being careful of pulling the trach out, but we're going to go under, cleaning behind the plate. Okay, then we're going to do the same thing on the opposite side. Go under, bring it through, throw that away, and then we're going to clean our plate. So we're going to dip this in the normal saline, clean the face plate. Okay, around it, and now we can apply our split gauze. Okay. And while I'm doing this, I'm also going to make sure that I'm assessing the skin around the tracheostomy. And this is to provide comfort. I'm going to make sure that it's not too tight. I'm going to clean up my mess. I'm going to assess the patient's toleration of the procedure. I'm going to make sure I document all my findings, the color of the skin, what I've done, cleaned up, perform hand hygiene, and that's it.